Good afternoon. Um, Everyone at our facility is a mandated reporter, but I'm only going to be talking about the social work piece today. We have over 100 people in the department, and our front line would be in the ED. And Patty Evans, who's the supervisor in the ED, is not able to be with us today, but she has 27 staff people in the ED that are there 24/7. And so that would be our front line. And then also in the Jan Carreri is here. She's the supervisor for in the pediatric area and OBGYN. And with her today is Esperanza Archie, who covers the NICU and OBGYN. SB, are you here? There, SB. SB's been on the unit for approximately 10 years. And then we have Sherry Pierce, who shares that service, NICU and OBGYN. And also Tony Bailey, and who works the preemie clinic, but she was in the NICU. And Maria Santiago and Melissa De Ramos cover the NICU and the PICU. And the great thing here is 3 of our workers, Sherry Pierce, Maria, and Melissa, were former DCFS employees. So that really kind of helps us understand and helps us in our relationship with DCFS. And I think that's worth noting today, because some came with considerable experience, I think even supervisory. And so it's just really good to have them on board to direct us and when to call, when not to, and keep us educated as well. I think basically, I think in the NICU and the PICU areas, we probably have 100% coverage of being able to screen and identify and refer cases. CCS mandates that we see all these patients within so many hours of admission. So we pretty much keep 100% compliance in those areas. So when the physicians make referrals, the nurses make referrals, but then the social workers will also do case finding, because they'll be seeing every one of those people. We're not quite as good maybe on the pediatric wards as staffing allows, because we have to pull staff to other areas when critical, but it's our goal to see every child who's thank you. It's our goal to see every child under 21 and under who've been in the hospital 3 days or more. So that's a goal. We don't always reach that goal. So in those areas we have pretty good coverage. We also have the jail ward, which is probably unique to LACUSC Medical Center. When anyone incarcerated comes and delivers, we automatically confer with DCFS on all of those cases for placement of the child. There may be a caveat there when if a person comes in with a private adoption arranged. But they can change their mind, and we're more comfortable if we at least consult with DCFS on those cases as well. So that's another environment. Of course, the substance abusing, whenever there's a positive tox screen in the NICU, we make those reports. If there's a history of use during pregnancy, we make those reports. If the history's old, we may not make that report in that area. We also have the reports generated. We have Augustus Hawkins, which is inpatient psych. When those women deliver, they're brought to the hospital, and we would also refer to DCFS on those cases as well. And then, our patients are unique. Some of them are homeless and mentally ill, and so we try to address all those issues while they're with us. It doesn't always mandate a report if they're homeless, but the mentally ill piece would come into play. So, a lot of clinical judgment and evaluation on our staff's part. We are a safe surrender facility, and so I think that heightens everyone's awareness of that role as well. I don't know. I accepted this invitation, the caveat that I would bring my team with me who actually does the work on a daily basis. And do you have anything to add at this point? I know we do have the issues of finding medical homes for our patients and working collaboratively, and that can be a challenge. And is there anything you would like to mention? So, we have over 100 people, and pretty much we try to keep everybody trained up. I want to say that in our environment, we have resources that are unique. we have the Wellness Center. And so we have Alma Family Services that can provide counseling and therapy. We have the maternal child access that can get these women connected with WIC and different programs that try to stabilize them. We have the neighborhood council, and they offer legal counsel if there's been an unjust conviction or one that they feel can be overturned, or if questions about their Medi-Cal coverage or their billing, those kinds of issues are getting linked to Medi-Cal, so they get help on those legal issues. And what's also very important is the Women's Center, who can help us with domestic violence and getting these women safely placed when they come in, if they're pregnant or delivered, and we know there's domestic violence, and we know there's a mandated report when there's children visibly seeing the violence, and so we try to. So those are the support we have. Now I must say that caveat is everything I've talked to you about does not include Dr. Hager's VIP program, which is also a wonderful support, and they're always often consulted on the abuse cases in the hospital, and they can go up and render their opinions as physicians, and especially when there's legal processing going on in that forensic piece. So we have that benefit of that support in our department too, that whole hub thing. So that's pretty amazing. So I think with the staffing we have, I think we're pretty comprehensive in what we're doing.